Hello, everybody. Thank you very much, Alex and Michelle and Laurie, for your presentation this morning and for the video. My name is Sarah Coffey Degrange. I'm a patient, I'm a survivor, and I am part of the French Bladder Cancer Patient Association. I'm standing in today for Helen Lacey, who's also on the board of the coalition. She's unwell, so please forgive me if I'm kind of stuttering and stumbling, but I'll do my best to replace her. I'd like to say thank you then for the policymakers for their contribution of what we heard on the video earlier on. We appreciate their recognition of bladder cancer and broader bladder cancer policy focus importance in light of our event in the political capital of the European Union. We've heard from Laurie, Michelle and Alex about the World Bladder Cancer Patient Coalition's achievements to date, and it's very, very heartening actually. And our vision of the future of bladder cancer advocacy from our patient community perspective. Our work is grounded in collaboration, and that's what we will focus on in today's session, driving policy progress in bladder cancer through collaboration. And I'm very happy to introduce, we're missing one person? Sorry. I'm very happy to introduce everybody today to, right beside me, we have Professor Hendrik Van Poppel, Chair of the European Association of Urology Policy Office. Next to Hein, we've got Christopher McPherson, Head of Global Oncology Policy and Advocacy at AstraZeneca. Then we have Elisabetta Zanon, CEO of the European Cancer Organization. And finally, Annika Novak, Head of Sector in the Cancer Mission Secretariat at the European Commission's Directorate General for Research and Innovation. Okay. So a little about me. My name is Sarah Coffey Degrange. I am a patient, a survivor. I work with Laurie at the Cancer Vessie France, the French Bladder Cancer Patient Association. I was diagnosed, and I'm on the board of the coalition here for the last year and a half. I was diagnosed with bladder cancer in 2017, a very, very aggressive form of bladder cancer. I sat in front of my urologist, I was 46 at the time, and he said, I don't get it. You're a woman, you're 46, you've never smoked, you haven't worked in the chemical industry, it doesn't make sense to me, but you're here. So I went through that year, I came through that year, I had an enormous amount of support from people all over the place. And I feel like it's quite a miracle to be sitting here today. In 2022, I actually, I was partaking in patient feedback, and I came across Cancer Vessie France. And I said to myself, well, I have to do something. I owe a lot to, I'm a survivor. I can't let other women come through this. They have to know what are the symptoms to look out for. They have to know, awareness is such a big thing. So I said, I need to add something to that. So my journey with advocacy, I guess it started back in 2022. And then recently I joined the board with the coalition here in Brussels. And I'm I feel privileged, I feel very inspired by everything around. And I know I'm going to be very inspired by everybody here today. So thank you. So at the World Bladder Cancer Patient Coalition, we have set out to collect an evidence base to better understand the challenges faced by bladder cancer patients and carers. We talked about this earlier on with everybody. And to be able to better represent our community needs using the patient report experience data. On this slide here, we've got three different things to highlight. In 2023, we published our global Bladder Cancer Patient and Carer Experience Survey, the first patient and carer survey of this kind and scope. Quite amazing achievement that Alex touched on already today. 1,198 answers, 45 countries were represented with 65 questions. It really was excellent. Alex covered this, some key highlights of the survey findings earlier on. So I won't go over them again. However, there is a wealth of information as well as 10 areas of focus that we have identified in the call to action that shapes our advocacy focus. You can find the QR code to access this survey report in the information packs that you have. In 2024, this data helped us shape our first policy publication, the white paper on bladder cancer, so the image in the middle there. Launched in partnership with the European Association of Urology and in consultation with patients, experts and policymakers, the white paper offered recommendations closely linked to the survey's findings and policy opportunities at the EU level and at national level. So we've got some great 10 top policy recommendations on prevention, access to diagnosis and treatment, awareness and survivorship. And then I like this one because the third image is the biggest image, and I think I feel particularly strong about this third image here. This year, in the coming weeks, we will be launching a new call to action report named Women Unseen, Tackling the Gender Care Gap in Bladder Cancer. This report builds on the foundation developed through a white paper on bladder cancer and is an example of another collaborative effort aimed at highlighting the challenges women face with bladder cancer diagnosis. Highlights specific actions to improve patient experience and outcomes for women with bladder cancer, collaborating with the global bladder cancer community to address this highly unmet need and improve cancer care for women with bladder cancer. So we're really looking forward to that. Here, we're going to look at the common themes emerging as priorities across these different publications. Early detection and diagnosis. Earlier, risk-based and gender-sensitive detection, particularly for women and those with atypical symptoms, are increased risk. Awareness and education. Both public awareness of symptoms and of risks, but also professional education, and especially in primary care and women's health professionals, are a priority. Access to information, support and counselling, ensuring equitable access to new, innovative and evidence-based treatments and access to clinical trials. And gender equity in bladder cancer care, addressing gender disparities, especially in timely detection, and promoting female-focused research, training and policy inclusion. Policy progress depends on collaboration between patients, clinicians, policymakers, researchers and industry. And on that, I would like to open to our multi-stakeholder discussion with our excellent panel of speakers this morning. Hein, I'm coming to you first. Are you ready? So, how can collaboration across sectors and borders accelerate policy progress for bladder cancer patients?
Thank you so much, and good morning, everybody. I would like to take the opportunity of me being here to highlight some of the achievements of my European Association of Urology. I'm a urologist myself. I must say that during the last years of my career, I did about 50 cystectomies a year, 200 radical prostatectomies a year. So I've been involved in oncological care during my career. Today I lead the policy office of the EAU, and this is where I have been working since I stepped down as chairman in the Catholic University of Leuven, just close to here. My association has about 20,000 members globally, not only in the EU. And one must realize that urology is not only cancer, but about all urologists, 65 to 70% of their work is on oncology, with bladder cancer, with prostate cancer, with penile, testicular and kidney cancer, as you might know. Now, bladder cancer at our Congress is about 15% of all the abstracts. So it's really a topic that is upcoming. It was less than 10% a couple of years ago. We have common sessions with ESTRO, ESMO, EAU. I think it's of utmost importance that we have this collaboration between scientific societies. It's not because it's a non-muscle invasive bladder cancer that multidisciplinarity and multidisciplinary teams should not even discuss these patients, because these non-muscle invasive bladder cancers can become muscle invasive, and then what to do? You have to involve the other specialists. And we have the yearly European medical oncology meeting on genitourinary cancers, the EMUC, where there is ESTRO, ESMO, the ENM, the pathologist, the radiologist, and the urologist sitting together, which is a real multidisciplinary meeting, and that's the way we can make progress, you can believe me. We have EU guidelines. I'm not going to go into detail on the guidelines, but you see that these are made with a panel that consists, again, of urologists, radiation oncologists, medical oncologists, psychologists, nurses, and patients. There's a representative of your organization that has been in the non-muscle invasive and muscle invasive bladder cancer. Lydia Makarov has been in, Wood is in, and there's a strange Danish name, I think Søren Bjørksen, who is now representative in the muscle invasive bladder cancer as well. The EAU patient office that I set up around now maybe 12 years ago is providing patient information. Everyone can look into it. It's really the translation of our guidelines in a patient-understandable language. It's translated in more than 20 languages. And on the other hand, and you are sitting here as a member of EPAC, it is the EAU Patient Advocacy Group, where obviously the World Bladder Cancer Patient Coalition is one of our estimated members. The patient office as well is helping us with the guidelines. In every guideline panel, there is a patient representation. Our publications, we have 4 journals: European Urology, Urology Oncology, European Urology Focus, and Open Science. All of them have a patient summary, so that patients can really understand what is on the edge of progress and science. And we are working very hard on shared decision-making, not only for bladder cancer, but for all urological conditions. Working with you and with bladder cancer dates back from many, many years. And you see on the left side, you see the first white paper we wrote actually in the 2006. And I think Mihaela Militaru is here, and she was working at that time with ECPC. I've been taken on with Andrew Winterbottom and afterwards with Lydia Makarov. Since then, you have seen already from Laurie also, we sit in the parliament together, talking with MEPs, launching the white paper. And you have also seen the e-urology sessions that we organize in our offices in Brussels, together with CPE, and where we try to show MEPs what is important. And you see Alex talking here, Torsten Ecke, and here's one of our first most important papers that we have published, really raising more policy awareness, more policy awareness on bladder cancer, which I think is hugely important. It's the forgotten cancer, as we called it in 2006. So, EAU à tous les étages. This means we are really everywhere. We are on kidney, we are on men's health, we are on incontinence, we are on bladder cancer, and we are really happy to collaborate with all of you. This has been alluded to as well. We have been heavily involved by this initiative, Women Unseen. There's a big problem with women and bladder cancer because of the misdiagnosis, the too late diagnosis. Men have more bladder cancer than women. Women are more likely to die from it because they are too late diagnosed. They are diagnosed as urinary tract infections and treated with antibiotics for years. And this really needs to change by re-education of the GPs and by the awareness among the population. And again, you see the people we are working with. It's the collaboration between the pharmaceutical industry, ESTRO, IUGA, the gynecologist, EAU, World Bladder Cancer Patient, and CPE. Now to come to an end, and this is the latest success story we have had, that's we replied to a call from the European Commission, EU Be Clear. This is on patient health literacy. We're going to do that with 3 countries, with Hungary, with Poland, and with Greece. And you see there is a number of groups involved: WONCA, the GPs, EAU, ECL, the World Bladder Cancer Patient Coalition, and Erasmus Rotterdam. And I know that I've been too long already, so I'm going to stop it here and hand over to our moderator again. Thank you so much.
Thank you very much, Hein, for your very valued input there. And it is fascinating to see how that collaboration all comes together. And as a patient, I'm very, very proud to see that. Tomislav Sokol, who we were meant to hear from earlier on, is now available. So we're just going to interrupt our little presentation here and hear from Tomislav for 5 minutes, more or less, I think. And then we'll come back. Okay. Right, it seems as though there's a slight little issue. Tomislav, maybe he might come in and join us a little bit later, but let's keep on going in any case. Chris, I'm going to turn to you. I'd like to now move and hear your perspective on the role of the industry as a partner in multi-stakeholder collaborations that drive policy and systems change.
Thank you. Is this working? You guys can hear me okay? No light, so it's a bit disconcerting. I have no slides, so it's fine. Look, thank you firstly for having me. Really appreciate the chance to come and speak with you guys. I started out my career as a political consultant. I used to prep people who went into the UK Parliament to speak on panels, to give testimony. And so there's a slight irony as I was prepping for this panel, and I shared that with some of my former colleagues who were saying that this is, kind of nice to see me have to stand up on stage and defend the things I told them were gospel for a long time. So firstly, thank you for having me. Very much appreciated. I think when it comes to partnership between industry, between patient communities, scientific societies, I think the first thing that's super important to kind of reflect on, and it's something that I actually heard very well articulated at the We Can Academy earlier this summer, which Alex and the team did a great job also organizing that event, is firstly to acknowledge that everybody has an interest. I come from industry, we have an interest, we are for-profit making organizations, patient organizations have their own interests, the things that matter to them, the goals, scientific societies likewise, but we all have a common interest as well, and that common interest is around improving care for patients, seeing improved outcomes for the patient communities that we represent, and I think that's something as a rallying cry that we can all get around. So firstly, when it comes to collaboration, I think just being really transparent about what those interests are, but also really locking in on where our shared interest lies, I think is super important. I guess the second thing I would reflect on, and this will be something I talk about as we go through the panel, is letting people do what they do best, I think is really important for collaboration as well. When I reflect on great collaborations that we at AstraZeneca have been a part of, in particular, I reflect on collaboration, the Lung Cancer Policy Network. For those of you who are not familiar with that, in that space of lung cancer, you may have seen over recent years just this absolute slew of achievements out of the lung cancer community when it comes to driving adoption of lung cancer screening. You only have to look across the continent of Europe in particular to see countries adopting lung cancer screening at a national level, consistently. We had last year Germany, the UK has done so, Australia, with some colleagues who were talking about that yesterday, has also done so. But where does that come from, that achievement? And the European Union also made some great recommendations around the push for lung cancer screening as well. That doesn't just happen. That's the product of years of work, dedicated work by the lung cancer community. And I think reflecting on what they did well is a useful blueprint for thinking about how we all collaborate to move forward in bladder cancer. So what they did very well at the start, I think, was firstly focusing around consensus and really listening to patients about what they needed, not just about the fact that, yes, it would be nice to have earlier detection of lung cancer because that's how we're going to improve patient outcomes. But why is it that traditional lung cancer early detection wasn't working? Why is it that one style of lung cancer screening service where people would go into their primary care facility worked less well than having buses that went out to the community and met people where they were? So really nailing down a vision and a consensus, and I think you guys already have a great piece of work there in the white paper that speaks to that. I think the second is on evidence, and this in particular I think is where industry can play a big role. We have a lot of data scientists, we have access to data, especially around patient flows, which sometimes the systems themselves don't have. And I think it's a particularly opportune moment as to how we make the case using compelling data for reform. Not just, if I think about lung cancer screening, what was the achievement there? It was making clear to policymakers that actually there is a huge financial gain to having people earlier detected from lung cancer, of having better lung cancer patient outcomes. It returns money to the system, and I think great data did that. And then having really compelling campaigns on the back end that help people to understand that there is more than, yes, an emotive argument for lung cancer, but also other really kind of important elements of helping to improve societal productivity and other things. And so, again, industry is, alongside other partners, we have very creative people, some very good digital capabilities that can also allow for that. So if I reflect on collaborations and what makes them great, I think letting people do what they do best. The last aspect to the lung cancer story, though, is engagement and is speaking in front of politicians. And sometimes industry isn't the best voice for some of these things. I think I would be the first to admit that. Our patient partners are much more compelling when it comes to how to put these arguments across than industry will ever be. And I think that letting people do what they do best, we can be supportive on the data side, we can be very creative on the campaign side, but sometimes we right to step back in other areas. And so I think as we think about the bladder cancer movement, how do we harness the best of what people do, and then sometimes tell people, hey, we don't need you at this bit. And I think that's going to be key as we move forward.
Thank you very much, Chris. Some lovely points there. Thank you. Elisabetta, I come to you next. European Cancer Organization is doing fantastic work in building collective impact through networks and coalitions. Tell us about how you do it, please.
Thank you very much for the invitation today. It's a pleasure to be here with you. The European Cancer Organization is really working on the principle of partnership and collaboration. It's part of our DNA. We convene healthcare professionals together with the patient organizations. We have in our membership more than 40 European societies representing the wide range of professionals, health professionals working in cancer care, cancer prevention and care. And we also have more than 20 European and international patient organizations involved, including the World Bladder Cancer Patient Coalition. And I would like to thank very much Alex for his great contribution to our work. So, collaboration, partnership, multidisciplinarities are key words in terms of the activities that we conduct in the European Cancer Organization. The other important element that I would like to stress is that the collaboration partnership is really important if we want to achieve a change. We have seen the important impact of the European Beating Cancer Plan, but also of the EU Cancer Mission at European level, and how bringing together, let's say, the stakeholders across the community, the different types of organizations, but also politicians, member states, European institutions, towards this joint vision of reducing the burden of cancer has really made a huge difference. We see very important results, outcomes of this collaboration. There is still work to do, of course. The work is not finished, and we really hope that moving forward there will continue to be commitment at the EU level to continue to see the fight to cancer as an important priority at EU level. So we are certainly advocating for that as a European Cancer Organization. Another important remark that I would like to stress today is the fact that certainly we see that some tumor types are receiving more attention than others in terms of European policy. Of course, there has been a huge, let's say, drive in terms of the 6 cancers which are covered by a council recommendation at EU level in relation to screening, breast, cervical, and colorectal in the first wave, and then in the second wave, prostate, lung, and gastric cancer. We have seen in these tumor types really a lot of activities happening. So, for example, in relation to prostate, to lung, and to gastric, we see pilot projects happening at the moment. You mention the significant progress that there has been in lung cancer, but of course also in the field of prostate, we see really very significant changes, policy achievements, and I have to say this is also very much a thanks to the great work of the European Association of Urology, which has been a driving force beyond bringing prostate cancer so much at the center of European policy focus. But we see that there is less attention on other cancers, and of course, bladder is a little bit, I would say, less at the center of some of these activities, and this is something we should be changed. 5th cancer, as the European Commissioner mentioned in his address. Also in terms of mortality, I think he indicated that is the 5th cancer in terms of mortality. So clearly not as prevalent as breast or prostate, but still very important cancer to be addressed. And I would also like to stress the huge unmet needs somewhat related to women. I'm really impressed by the fact that you will launch this new paper initiative on women unforeseen. Unseen, thank you. Unseen, not unforeseen. Unseen, thank you very much. And I think there is a huge unmet need in terms of women. You shared your story, the difficulty in terms of diagnosis for women. Very often they are diagnosed with urinary tract infection, while in fact they have cancer. I have a member of my family right now going through this. She probably developed bladder cancer several years ago, but for several years she was told that she had urinary tract infection, and she was only diagnosed several years afterwards. The cytoscopy was negative, was not showing the cancer at the beginning, and it was only when she ended up in the emergency department in the hospital and several tests were conducted, more sophisticated tests, that the cancer was seen. And eventually she was supposed to have surgery for her cancer, but in fact, when the surgery was supposed to be performed, then it was realized that in fact the cancer had spread too much. It was no longer, let's say, possible to remove just the little cancer. And because of this, I would say, we can really see that there is a huge unmet need, that there is a need of doing something more specifically related to women. We do a huge amount of work specifically related to women in the European Cancer Organization, including trying to influence the gender equality strategy at EU level, which will be released, I think, next year, in fact, in 2026. And we will certainly try to draw more attention to this, let's say, gaps that we see specifically related to gender and women. Thank you.
Thank you very much, Elisabetta. Very wide scope and all of that. Annika, could you now in turn, could you please tell us about EU research and policy frameworks enabling collaboration and innovation?
Yes. Yes, you can hear me. Well, good morning, everybody. And thanks for inviting me to bring a bit more clarity what we are doing, I mean, as a commission, but more specifically from the DG research side of things. I have 3 slides, I think, if you can display. Yep. So there was already, I can move it. Very good. So well, don't worry. I won't go through the entire slide, but just briefly, I mean, what's the mission about to understand the context and also the relation then to the cancer plan, which many of the speakers, also the high-level speakers, have alluded to, and with a focus on what do we mean with collaboration and what do we have done to translate collaboration into a very concrete action. So, I mean, the cancer mission still being a fairly new instrument under the Horizon Europe program, started in 2021, so we now have 4 years, but we still have a couple of years in front of us, so we feel kind of being midway to reach the cancer mission goal, which is to improve the lives of more than 3 million people. And there is a focus on prevention, cure, but also on quality of life issues for patients, but also for families. And in doing that and reaching the goal, we really go hand in hand with the more policy initiatives, hence the Europe's Beating Cancer Plan. Well, we have concrete actions, and I will really only zoom on what regards the engagement and also the synergies, because for me it's part of engagement and making sure that all the instruments we have at EU, but also at national level, are being combined to reach the goal. Very briefly, maybe because it was mentioned also the importance of data. I didn't touch anything. The importance of data. There are also important data platforms that are being developed. And also citizens' engagement is an important part of the missions. Well, let me move on to explain what we mean with engagement. So with the cancer mission and the cancer plan starting the same year. So 2021, we felt having this opportunity of having a more research-oriented initiative combined with a broader policy initiative such as the cancer plan, we need to make sure that both are implemented in a very consistent but also synergized way. So we really developed a kind of narrative around what is the mission can do to inform the cancer plan, so by providing the evidence and innovation, and the policy side of the cancer plan informs the research agenda. So how we do that? We build what we call a joint governments to implement both initiatives in the same way, in a consistent way. So first of all, it's a dialogue with the member states. So what we have is called a joint subgroup. So it's health and research ministry, so delegates from these ministries sitting together in the same expert group, which sounds in first sight very boring, but it's very important that they talk together at European level, but we make them also talk among the same ministry or in the same country. So this is something which is now happening then more than 4 years, and it's much appreciated, and I think it has already created a different level of interactions between the two policy areas. We have done the same with the stakeholders, so trying to engage the stakeholders always from both sides, so with cancer issues, cancer plan actions and priorities, together with those of the mission. And the same goes also for the Commission services, so much more than in any other initiative I've been working on, there's an almost daily exchange with our colleagues in DG Santé, but also connect when it comes to data, environment, on the prevention agenda. So it's much more in a structured and natural way to consult, to have an exchange, to coordinate really in a systematic way. So that's the EU level. I think it has developed well. I think things to be improved, but we felt we should also bring that concept to the national level, because where the implementation then of innovation should take place, it's obviously at the national and regional level. So, and that's where the national level with the national cancer mission hubs come in. So these are entities that are being built in the member states at national or regional level that should really facilitate the integration of the European actions into the national system. So by adapting to the needs of a country, of a region, when it comes to screening programs, you name it, it's really also, you know, to have a level more, besides the ministries, to integrate that. And how is to cross-policy dialogues. So again, something we are trying to do at European level should happen at the national level. And that's where all the stakeholders should come in. So these hubs are not just an entity in the ministry, it's more a cross-policy getting together of the relevant stakeholders, of all stakeholders. Nobody's excluded, and it should also go beyond the cancer community. So it's supported by a project. It will run still a couple of years, and at some point, obviously, they should be there to stay. I don't go into the international level, but this is also where we see collaboration for very specific areas in the area, for example, of rare cancer, where we see opportunities and the need to collaborate also at the international level. Moving on, again, it's really to try to demonstrate you how we are trying really to build in the collaboration. So I've already explained with the cancer plan, obviously was the most obvious policy initiative, but I have to say there are also other legislation which drives the implementation of the mission. The European Health Data Space, that's the legal framework within which we now develop our initiative. So the Uncanny EU will become a federated network of data sources, but it has to comply obviously with the health data space. So just to repeat, I mean, the role of the mission is, you know, to generate the scientific evidence. We have already invested 500 million for the first 4 work programs. Now the 5th work program is kicking in. We have now about 60 new mission projects. The mission is also about to promote the citizen engagement. Again, a concept we developed at the European level. The most prominent example of that is that we launched 3 years ago what we call a dialogue with young cancer survivors. So a group of young survivors that inform us through exchanges, through workshops, what does it mean to be a survivor? What are the real challenges and problems? And this is an active listening from our side, and has already shaped innovation topics, research, that we then have implemented through the work programs, and now the projects have just started to run. So it's really a direct commission listening to survivors concept, I think, which is fairly new in the sense that it really shapes research and innovation priorities, but also can inform the policy side of things. And this is another area where we hope that this is being replicated through the mission hubs also at national, regional level. So it's part of, once these mission hubs are created, they should also do citizen engagement activities. And that's, I think, also important for you as a community, that you hook onto these hubs, that you also promote these concepts, because that's within the mandate. I don't go through, I mean, building synergies for me is, yes, it's about leveraging more funding, but it's also to have more partnerships. So we have partnerships, established partnerships through Horizon Europe. So there's IHI with the industry, there are other missions. We're also trying to build parallel topics with other EU programs. We try to engage through Horizon Europe cancer charities. One goal is to leverage funding for research, but it's also in that sense that we really enhance the collaboration among the different stakeholders in the cancer research community. The clusters, very briefly, just to mention, because we also have in the beginning of November the next policy webinar. So clusters are, mission clusters are clusters of projects that had been launched under the cancer mission since now 21-22, that we bring together these projects and stimulate a collaboration among those projects. So among the researchers, but in these projects, they're not just researchers, they're also patients, organizations, industry. And within a given cluster, let's say the understanding cluster, it was one of the first ones, they should collaborate on certain activities. So data management, communication, citizens engagement. So it's part of their grant agreement, so part of their mandate, they really have to deliver that. And in addition to that, we organize what we call policy webinars that we bring together the people from these projects, but also with other actors. So policymakers, other projects, that they come together, reflect commonly what is it about collaboration, but also how I see my research work done now, but what is in 5 or 10 years, how I make sure that these results that should come out of my project, my research, are then being integrated. So also, so that mean we bring the community together, we engage the researchers in this, well, discussions beyond the research, so to say, really with a view how we can make sure that the results will be then implemented soon. So I want to advertise and finish on that. The next is on the 3rd of November on diagnostic and treatment. It's an online webinar, so please sign in. Thank you.
If that is the case, we'll just go back to what we were going to do previously. Now I'm going to ask a question to 2 people and then a second one. I'll start with Hein and Annika. How, in your opinion, can we better connect research, clinical evidence and policy action to ensure bladder cancer receives stronger attention within broader cancer and health policy frameworks? Annika.
You go first, Annika.
Fire ahead.
As you wish. Well, maybe just to come back on what I have already mentioned. I think, I mean, generally speaking, there is a lot of discussion now in the research policy area, I mean, at European level, how we can better bridge that. I think for what we've trying with the cancer mission is that, to give you one precise example, which I haven't mentioned, when we still as a DG Research, we have our dedicated ring-fenced budget for the work programs, so for cancer specifically, and then we then develop the topics. So developing topics, that's a conversation then we also have a lot with member states where we put the focus. That's one thing. But the second is within the topic text, so which is then published and which then the research communities can apply for. We've been already trying to build on some elements where we foster the collaboration. First, the synergies, and clearly in the text is that the research should already think of what is there in terms of the policies. So they have to look at the policy side of things to which they should serve also with their research, but also to, not building things from scratch or, researching, but there is a lot of actions they can, get the data from, so the Joint Research Center, existing platforms or actions that are being developed under the plan, under the mission. Second, and that's what I alluded to, the clusters, they have to foresee a budget for collaboration within these clusters. So it's a mandatory element. On what they want to collaborate, they can identify themselves, but then it's part of their contract, so what we call the grant agreement, something they sign between us and the Commission. So it's in a way a structured way to enforce, and with the ultimate goal, again, to bring for research the expected results together and make that translation so that approaches. It's some pieces, some approaches which are different to what have been done in cancer research or research maybe in general. It's a general trend, but with the mission we had the opportunity to do things differently. Mm-hmm. But on a second note, this had to be also communicated, because putting it in the cortex is one thing, but really the first years we did a lot of talk to draw the attention. Now you work in a bit different environment in terms of collaboration, policy frameworks. You need to think it through while doing your research. I think that's one element I want to stress.
Thank you, Annika. And Hein?
For me, one of the key points is we need much more visibility of bladder cancer. You all know the story of prostate cancer, how successful we have been. Bladder cancer patients and bladder cancer patients dying are mostly not famous people. We have seen very famous prostate cancer patients, politicians, world leaders. And this results in less funding for research, which is absolutely unacceptable when compared to more common cancers, what we have today. And this has to do because we do not make policymakers and politicians understand how much we underestimate the cost of care for bladder cancer. If they would understand that, then they would pay more attention to it. And collaboration, of course, we have been talking throughout this meeting today. Praise You has come not from the fact that we as urologists or medical oncologists were sitting together and saying we should do screening for prostate cancer. It has come because we have spoken to politicians to make them aware of the fact that late treatment of prostate cancer is very expensive, while screening and early treatment is not that expensive. And this is the awareness that we need to create. The collaboration is extremely important. It's not the urologist and the medical oncologist who knock on the door of the policymakers. It's the patient organizations that knock on the door. If I knocked on the door for advocating screening with the politicians, they said, you're a urologist, you want to see more radical prostatectomies to make more profit. So the collaboration not only with medical oncologists, radiation oncologists, nurses, psycho-oncologists. We are looking at the effect of screening on the psycho-oncological point of view. Health economics are involved. We have a very strong group in the consortium. And we need to do the same for bladder as we have done for prostate cancer. And then, thanks to ECHO also and the Commission, the two other cancers, gastric and lung cancer, are now lumped together. We will have a summit in February where it comes already to an end. We will have an extension because the three cancers have been fighting together to get another 7.5 million euros to extend our efforts. So working together with all these people that I mentioned and working together with the entire cancer community is, in my point of view, most important.
Perfect. Thank you very much, Hein, for that insight. We are running short of time, so it's going to be, my last question will be very short and sweet. Really, I want 2 words max per person. What one piece of advice would you share with bladder cancer patient advocates here today and on how to be effective in driving policy change nationally? Really very succinct. You have got 50 seconds from each of you. Collaboration, working together.
Impose the introduction of national cancer plans where bladder cancer is included. Mm-hmm. There's no cancer plans in all EU member states, and that's a shame.
I think that's a really good point. For me, the point would be don't wait. So, we talk about consultations, we talk about the decisions are made when the consultation goes out. It's already made. I think it's a very, get in early, shape what the consultation is on. If it's a national cancer control plan, yes, there's a nice process to it. But if you don't have the agreement with your Ministry of Health that bladder is already going to be in there by the time the consultation comes around, very little will change often. And so I think don't wait, be proactive, and put things in writing, because you put someone on the record, you ask them for their response on a topic, it makes it much more likely to happen.
Perfect. Thank you, Chris.
You say join forces with us to advocate for cancer to remain a strategic priority at EU level, and ensure that as part of the activities of Europe's Beating Cancer Plan and the Cancer Mission in the future, there will be an attention to bladder cancer. The economic point, I think, is a very important one.
Annika.
Well, since you have already pleaded for help, I don't need to do that. But I can just reinforce that I think at EU level, the collaboration and support is great. And also what, the patient organizations are doing, I think it is very effective. We hear the messages. But I think equally important and supportive for us is to do it at the national level. But now with the MFF discussion, so the future financial framework, MEP Tomislav Sokol has alluded to that. I mean, there's something foreseen, but it's not that clear, not that secure for cancer. So I think there is where then the national level comes in, and where you can play a major role, I think, to make sure that this is listened, that the MEPs, the member states, can play a role. So that's just almost beyond my mandate.
Thank you, Annika. Thank you all very, very much on behalf of the Coalition for coming today to be on our panel, for discussing so openly your different thoughts on all of this and collaborating together. It's been really, really very enriching. You really are long-term valuable partners for us, and I'm sure that we're going to be seeing loads more of each other for many years to come. So thank you very much.
Thank you.
Thank you.